Hello, I'm Dr. Dennis McKenna. Today I'm joined by Fran Spear-Alpert. Fran, it's great to have you here.
Thanks for having me. Happy New Year.
Happy New Year to you as well. Fran, of course, is our System Chief Financial Officer and System Chief Operating Officer. And we're going to talk about things that obviously you are the content expert on here in a minute. So welcome to the chair and Happy New Year to you as well.
Thank you.
Today is Monday, January 8th. Now, Fran, who was born on January 8th?
The King.
The King. You want to be more specific?
Elvis
Because there's a lot of things out there. But certainly Elvis was born on January 8th. We were talking about that beforehand, so we want to have a couple laughs with that. What we're going to talk about today, we're going to do a quick system year in review. Not everything that happened in 23, but touching on a couple things that happened in the last quarter that we think are noteworthy. We're going to talk briefly about Care One and our upcoming go live with Epic. We're going to talk briefly about visitor restrictions here in the hospital because it is the winter cold season, and then a little bit on System Story. Now, Fran, before I begin, I also want to say that we're going to be having our town halls, our open forums. They start a week from today. So Monday, January 15th, they'll start. Please look for those on the intranet. These are an opportunity. I think there's about 6 or 7 of these. I'll be at all of them. I know you join me for many, if not all of them. We'll do some on the main campus. We always do one at South Clinical Campus. We go down to 1275 Broadway.
Yes.
We do early morning. We do late evening. We do weekend. There should be a time for everybody, and we videotape one of them. Okay, so a lot of good opportunity to get caught up. And again, that's a much more comprehensive look back at the previous year, and importantly, a very deeper dive into what we're going to do in 24. So we'll touch on some of those things today. So Fran, I mentioned this. There were a lot of things that happened at the end of 23 that I think are positive, noteworthy. We kind of want to highlight those. Let's talk about what I will call the bring to minimum and the market adjustment. I know this is something that you were heavily advocating for. You always advocate for our workforce. What were those two things?
Oh, so very exciting investment in our workforce. We made a 20% increase in our minimum starting wage. That impacted more than 6,000 employees. And the reason it impacted so many, it wasn't just those employees at that starting wage, but we implemented compression adjustments for all the other employees so that there would be equity. And we were just really proud to make that level of an investment into our workforce.
And that was the first decision we made when the Medicare wage index adjustment came in. We wanted to reinvest that in our workforce, as you have said. You know, many of the people who are positively impacted by this are people who come to work every day. They're a huge part of our team, often not necessarily front and center, right? They're not at the bedside caring for people, but they are so critical to our mission, right? And the people, whether it be environmental services, food workers, transportation, obviously our security workforce, everybody impacted by this.
Yes, absolutely. Yeah. Tried and true, and they were so grateful and excited by that news.
And we ultimately have other adjustments that we know will be made in 2024 as well. But that was a big step forward on that.
Yes.
And the total dollar value of that adjustment, if we quantify it.
On an annualized basis, that adjustment alone is worth $13 million.
Wonderful, wonderful. Well, thank you for that. And obviously, we were very proud and privileged to be able to do it. We also are continuing to work hard on our recruitment retention strategy. In the middle of that is bringing in new people. Our human resources department and their business partners have been very busy.
Absolutely.
I believe in 2023, they were logged over 80 different recruitment events. Human resources, one of the center operations that reports up to you. Talk about the work of that team.
So they are so vested in growing our workforce, and they do that in collaboration with many of our other operational leaders. And we have the most successful events when we do collaborate with those managers. And can't emphasize enough, though, the importance of retention. So we've talked about that, and Dr. McKenna just said retain, recruit, retain. We do all we can to bring new members into our workforce, but it's up to all of us to keep our workforce engaged and happy and content. And the number one driver to someone making a decision to leave, or more importantly, to stay, is who they're working with. So that means it's all up to us.
I think I've talked about this every single Monday. I kick off the week by going to and meeting and talking to our new employees.
Yes.
And every single week we have between 40 and sometimes as many as 60 new employees every week. It's wonderful. One of the questions I always ask is there anybody coming back? And I've said this before, we know for various reasons employees have left us for a period of time, but I'm seeing more and more hands raised when I say, is anybody coming back? And that's something that's very positive as well. I think there are people who, for different reasons, maybe have left this campus for a while, but they're coming back, and that's also very positive.
I think right off the top of my head, a key member of our access team, a
Right.
key member of our
Right.
finance team.
Right.
These are individuals that started here, trained here.
Right.
We stayed in touch with them
Right.
after they left Albany because we wanted to know how they were doing.
Right.
But we're also hopeful that one day they would come back, and now they're just integral members of our team.
Wonderful. Last item to do in review is there was a lot of effort on what we call our financial mitigation plan.
Yes.
This has actually been going on now since September 2022. 2023 was a full year of it. There were 8 different domains. There's executive sponsors of each. There's key performance indicators. We measure, we monitor, we look to continually improve. Were the efforts of the financial mitigation plan positive? And if so, how would you quantify that?
The efforts of the financial mitigation plans were tremendously successful. They accounted for a $65 million turnaround in our performance. And one of the things that we've been most proud about, and Dr. McKenna and I have spoken a lot about it, is our financial mitigation plan was 100% tied and aligned with our mission.
Right.
It was all about how did we do that? We did that by caring for more patients who needed our help.
Right.
We did that by teaching more students, by conducting more research. So there was 100% alignment between meeting mission and achieving financial stabilization.
And one thing that you have said many times, and in fact I say it now every week at our new employee orientation, is we are a not-for-profit organization. We are community owned. We do not have shareholders. We do not pay dividends, but we must reinvest in the community.
Absolutely.
And we must reinvest in our workforce. And those are the things that we do. And by having a significant turnaround in our financial mitigation plan allows us to do those things, whether it be bring to minimum,
Yes.
market adjustments, new technology, and other ways in which we invest in the workforce. So to everybody who worked on that, and that's everybody on our team, thank you.
Absolutely. Huge thank you.
Another thing that we need to do with the financial mitigation plan and the benefit of that is to use that for our technology platforms.
Yes.
And we talked about Care One, which is a bring to standard and a cybersecurity enhancement of our systems. And then it's putting in our new ERP, which was done
Yes.
in July of 2023 with Workday, and now in 2024 with Epic for our electronic medical record. We are still on track to go live in the first quarter of 24, and everyone is working really hard there.
We are, and everyone is so aligned and excited about what this is going to do to their daily work. It's going to simplify work over time. It's going to allow them to spend more time with their patients, less time on administrative efforts, and we'll be on the same platform by the end of the year across the entire system.
So we're taking, well, I think by most measurements, 11, 12 different electronic medical records and moving them to one platform across the system. When people hear electronic medical record or electronic health record, they immediately go to care at the bedside, which of course is a huge part of that. Interestingly, I was talking to Brenda Pasquarelli today, who is one of our leaders in Access, and she was talking about how for her team, they're looking forward to it because right now when you come in for care, in radiology or lab or other areas, you might need to be working in 3, 4 different systems, and it's all going to be one. So it's not just about the care delivery at the bedside, which is hugely important, but it's about the workflows for everybody else.
Yes, the RevCycle team across the system has been aligned from day one, consolidating their teams, consolidating their workflows and policies. This will be a game changer for them.
And there are a couple key milestones between now and go live. One is what we call our go live readiness assessment. So we'll be at 60-day go live readiness assessment, moving more things from red to yellow, more things from yellow to green, and ultimately we'll measure how close we are to being ready to go. There's something called a technical dress rehearsal, where they look at every single piece of equipment that interfaces with Epic.
And probably a lot of people have had someone visit them and test out their equipment, make sure it works.
20,000 different devices, printers, monitors, whether it be infusion pumps, the whole thing. If there's a green sticker on there, Leave it on there because that means it's been tested. And then something that I know is very important to you, parallel rev cycle testing, where Shelley Breton and her team look at all the different workflows and making sure that we can register people as well as drop a bill and get paid.
Absolutely. That is the testing that will ensure when we flip that switch on and go live that your work day will go relatively smoothly, and we'll do all the things that we're supposed to do for our patients, for our providers, and ultimately for our billing process.
So Fran, you're very good at taking complex issues and kind of making them easy for people to understand. This is one of those. What would your message be to the workforce as we're moving towards that date where we're going to go live, there's going to be a lot going on? What would your message to them be?
Stay calm, stay focused. Don't expect things to go perfectly. They never do on a project of this scope and scale. But what will get us all through it is that we stay positive and keep our eye on that end game and support one another, and support each other, and particularly support that core Epic team who have worked 2 years plus,
2 years plus
so hard getting ready for this.
There'll be super users out there. There'll be trainers out there. There'll be a lot of at-the-elbow support. We'll obviously have a command center up and running for weeks, honestly. It won't just be a flip a switch and we're live in 24 hours. So I think your message about being calm is a great one.
Yes.
And we'll get through this. And it's going to be fantastic when we're
It
through
really is. Yeah. And what we're building up to with Workday and with Epic, we bought the two best systems in the industry.
Absolutely. Thank you. Let's talk a little bit about visitor restrictions. You may now have seen a posting on the intranet about visitor restrictions. Why are we doing this? I like to remind people we've always done this. In fact, I was talking to the clinical team just the other day, even before COVID, right, before 2020, whenever we would enter into the winter months, there would be a declaration by the New York State Department of Health and the health commissioner, in fact, that would say we are officially in flu season.
Yes.
And that has occurred again. It happens every single year. Once that happens, we put into place visitor restrictions, which, again, were done even in the 2010s, where we do a couple things. Number one, we limit visitors to those who are over the age of 12, okay? The second thing that we do is we limit the number of visitors to 2 at a time. And then, as always, we say that we don't want anyone coming in the hospital who has symptoms like a cold, or we would add rash or GI illness. Now, everybody knows, you certainly have heard me talk about this, I believe very strongly in the power of visitation and the importance of having people at the bedside. There are always compassionate exceptions for circumstances where it may make sense to let somebody in the hospital who's under 12, but those should be rare, but there is a process for that. But this visitor restriction is something we do every year.
Yes.
Like I said, we did it before COVID. I suspect we'll continue to do it. It's a seasonal thing, and we'll hope to be able to lift it as soon as it makes sense to do so. So any questions, the information will be on the intranet page.
Makes a lot of sense.
All right, very good. Lastly, let's talk about system news. In fact, that's what it's called, System News. There's a wonderful one that our marketing and communications team has put together. And the story is one where we're talking about the system.
Yes.
Columbia Memorial Health, Albany Medical Center, Saratoga Hospital, Glens Falls Hospital, visiting nurses. And rather than just focusing on what's happening on 43 New Scotland, we talk about events throughout the health system. It's really a wonderful one. Little snippets of stories from everywhere. A really, I think, powerful story about the power of our logistics center and our transfer process caring for one of our own. I encourage you to read that. It really is special. And I want to thank the folks who put it together throughout the system and especially on this campus. A really wonderful job.
It's a great story.
Yeah.
And as Dr. McKenna said, please watch it and listen. It speaks right to what we try to do every day for all of the community members.
That's right. That's right. All right. So that'll wrap it up. Any final words?
No, just very excited to be going into 2024. We have a lot of great things to look forward to. By the end of this year, we'll be live on Epic across the whole system and ready to rock right into 2025.
All right, well, one step at a time. All right, very good. I agree with all of that. And I thank you for being here.
Thank
Honestly,
you.
wonderful. And we'll, of course, we'll be back again in a few weeks. We ask that you once again, please take care of yourself, take care of each other, and we'll see you in a couple weeks.